Hi, and welcome to Zoomies. Today we're going to be doing what I like to refer to as a full consultation. These videos are made so that you can have an in-depth and thorough understanding instead of a quick overview of certain conditions regarding your pet. Today I thought we'd focus on what's called otitis externa, even sometimes otitis media, which is basically infection or inflammation or irritation of the outer pinnae of a pet's ear, or the outside of a pet's ear, as well as the inner ear canal. There are a lot of factors that actually contribute or cause this type of irritation for a pet's ear. A lot of underlying issues, some of these even occur together, and this is what we'll be discussing today. I'll try and refrain from using large medical words, and those that need to be used I'll explain in depth, but hopefully by the end of this video you have an absolutely clear overview of everything that contributes to an infectious or inflamed, scratchy, irritated ear for your pet. This is both for cats and for dogs. Before we start, I should mention ear issues are way more common in dogs than in cats, at least here in sunny South Africa. But we do see them in cats, and you treat them very similarly. So I think let's get us started with. This is in no particular order. While talking about these causes, I will obviously mention which are more common, which are less common, and what you can do from your side. This is now for owners and for veterinarians. So probably the largest cause of ear issues is infections. Infections are for microorganisms such as bacteria, yeasts, and fungi. These sometimes, actually a lot of the times, occur together. With bacteria, there are obviously numerous organisms, but the common groups that we refer to are cocci and rods. Cocci being your way more common infection, and rods being your more resistant strain of bacteria. Sometimes this is when veterinarians would do ear smears, identify the rods on a smear, and would actually opt to do cultures and sensitivity to try and see which type of antibiotic would be effective to use against these types of bacterial infections. But then you also have opportunistic infections like fungi and yeasts. Some of these species, like Malassezia, which is a type of fungus, actually occurs in a pet's ear normally, as in, like, if you would do a culture or sampling of any healthy pet's ear, that you would find these organisms. But they're very weak organisms, and they actually struggle to survive in inhospitable environments. So the moment you apply any type of ear cleaner or just thorough hygiene with your pet's ear, they tend to die off. So they kind of need something to pave the way for them, and normally that's where bacteria come in. The bacteria would kind of disturb the immunity of the ear, cause a kind of a hyper response, and then Malassezia would be your secondary infection that kind of proliferates along with those. So you kind of see the two together. Then an easy one for pet owners to identify, very easy, are actually ear mites or any type of kind of external parasite. These are ticks, fleas, and mites. Ear mites, in my experience, are actually not that common. We actually don't see that very often. Typically, you would present as a pet that would maybe have mites as a whole, as a miliary problem, as in everywhere on the pet, and then that would include ear mites. Same for ticks. They're so easily identifiable, and also luckily very treatable. I mean, you just use any kind of topical parasiticide, and your problem is resolved. So you can even just, if it's something like ear ticks, you can just remove them yourself. Sometimes, obviously, if they're very deep inside the ear canal, that can make it quite difficult. But for the most part, they're actually pretty easy to resolve. Now, another kind of easy one to identify, easy one to resolve, are foreign objects that get stuck in the ear canal. These typically tend to be grass seeds. I've even had a fish hook that I needed to take out of a pet's ear, which is awesome for a vet to take out these things. They're so satisfying. My wife even had to take one out of a dog's nose the other day. These are awesome to take out, and they're plain and simple to resolve. Sometimes you can obviously get a secondary infection from these foreign objects, and trauma, of course. Again, we spoke about the Malassezia that can proliferate from that. But foreign objects, these typically present with an acute onset, as in the pet never has any history of any ear infections or any ear issues. Suddenly the pet can't leave the ear alone. They're constantly scratching. They could be very painful. The ear could be very inflamed. And then what the vet would do is they would just use an otoscope. They would identify the foreign object in the ear. You just need some alligator forceps, and you kind of just remove them just like that. Easy. And obviously, these are pets that like to run in tall grass. I know this is especially a problem in the United Kingdom with that acute onset. So it's one of the first things I used to rule out when I used to work over there. Then there's a condition called seborrhea. Seborrhea is basically the overproduction of earwax, and this tends to be kind of more a problem in Dachshunds. Typically not that common, and very easy to resolve. All you need to do is just use a ear cleaner that dissolves wax. Any like Tris EDTA or trisodium EDTA product, they're very common. You can ask your vet about it, and they work really, really well. And this typically will be a chronic condition for this animal, so you would kind of need to maybe clean the ear quite regularly to avoid that excess wax buildup. Because why is that important? Well, it's an adherence ground for bacteria and yeast, so kind of just need to remove that. Trying to just kind of go into order of all these things. Okay, another one. I mentioned it with the foreign body, and that basically is trauma. An easy question to ask yourself: did my animal potentially hurt their ear? Sometimes what happens is puppies, they gnaw on each other's ears, cats that scratch dogs' ears, cats that get into cat fights. These can sometimes not actually cause major trauma, but can actually trigger a bit of an inflammatory reaction. Animals will do what animals do, and they start scratching. And once they start scratching, they launch an even larger inflammatory response, and now they can't leave the ear alone. And then those animals are also pretty easy to kind of help out. You would kind of exclude infections. You would scope the ear and not see any foreign material. You might even see the area of trauma, the scratch mark, the bite marks, and then kind of just address the inflammation, address the pain. They're pretty simple. And again, hygiene is obviously important. In most of these ear issues, hygiene is kind of your best friend to go with. The only thing I need to warn against is that with any trauma of the ear, you can develop what's called an othematoma, or an oral hematoma. This is basically where the two layers of the ear, well, if you I always explain as in there's roughly two layers, the inside and the outside. There's obviously a cartilage layer and all this, but these two layers get split by a burst blood vessel. This blood has nowhere to go, so it pulls between these two layers and actually distends the ear, and now you have this very kind of enlarged, inflamed, and fluid-filled ear. Again, pretty quick onset. A day or two, owners come in and say, my dog's ear is swollen, there's fluid on my dog's ear. The nice thing is about this is that they can be very easy to treat. Can be, emphasis on the can be, where you sometimes just drain the ear. You want to kind of trigger a little bit of an inflammatory reaction on that inside, so we'd like to inject a cortisone or something into that same pocket where you just drain that fluid out. Maybe causes some irritation and allow for these two layers to adhere again. That doesn't happen a lot. I give my clients a very poor prognosis on that and say there's maybe a 10 or 20% chance that this will work. Most of the time, it leads to where the animal would need surgery to correct this oral hematoma and othematoma. And for those, actually, prognosis is very good and actually resolves really well. And you can actually treat it completely and the animal never gets it again. Again, if the animal traumatizes the ear again, of course it can happen again. But that can be a consequence of trauma to the ear. An underlying factor that I know I ask a lot of clients, and it's especially a problem in dogs that like to swim or go into water like German Shepherds and your Spaniels, is excessive moisture. A good tip is what I always explain to people, especially in animals that get kind of recurrent ear issues, is I tell them, keep your dog's ear clean. When you get back from the park, from the swim, from the walk, just use any over-the-counter medication, flush out your dog's ear, wipe it out, make sure it's dry, and you avoid 90% of your issues. That's probably where most of the issues start, is that people, I think from not doing it on purpose, but maybe from ignorance, just forget to clean their pets' ears. This is with regards to swimming or day-to-day life, and that's where probably at least more than half of your ear issues start, is by poor ear hygiene. So just a little tip from that. I'm leaving the best for last, by the way. A big and unfortunate thing to talk about, obviously, is cancer. You can get masses like polyps and that are benign, that are easy to treat, but obviously you can also get neoplastic issues in the dog's ear. These tend not really to be itchy, but animals would pay special attention to their ears, and once the vet scopes the ear, you might identify the mass growing inside the dog's ear canal, sometimes on the outside. These are obviously a bit more tricky. Really tough to kind of cut out neoplasias on the ear, or especially inside the ear. These tend to be referred to specialists. They would need to be biopsied, or even fine needle aspirates need to be taken to try and identify what mass it is. That kind of does also determine your prognosis. These are never nice talks to have with clients, but again, at least they're very rare, especially in the inner ear canal. Very rare. The outside of the ear, cats, white cats that like to sit in the sun, they tend to get squamous cell carcinomas. Then the ear needs to be removed, or at least parts of it cut away. But luckily, neoplasias of the ear are quite common. Another common one is dermatitis or eczema. Of course, dermatitis, in my opinion, this is just my opinion, isn't really a sustainable, or actually a very accurate diagnosis to make. Dermatitis, that just means inflamed skin. That doesn't really explain what the underlying pathology is. Same with eczema. Yes, dry, flaky skin. Okay, but what is the underlying pathology? These tend to be coupled with other skin issues, which I'll get to shortly. So these are more kind of cofactors that you would identify with ear issues, but they might need to be addressed still. It doesn't make them, something that the vet would just brush off. If there's eczema, clearly moisture of the skin needs to be addressed. So the vet should attend to those as well. Now, lastly, your big two. Autoimmune skin issues can also affect the ear and can be very itchy. These are called pemphigus most of the time. They're very tough to treat, and they tend not to be just confined or restricted to the ear. They definitely affect the paw pads and the limbs as well. Obviously, the rest of the skin can be affected as well, and these kind of need systemic treatment. I've had a few cases that were pretty tough to resolve. I've had other cases that responded fantastic to drugs. Yes, but this is a very difficult talk to owners, and most of the time these would need biopsies to be taken to identify, which can be quite a long process. But then probably the most common reason, or at least comorbidity, for itchy ears are allergies. There are roughly 3 types of allergies. Roughly: environmental allergies, contact allergies, and food allergies. In my experience, less than 5% of dogs have food allergies. Less than 5%. I think owners tend to overemphasize the importance or the degree of food allergy. That's, again, another talk I have to owners, that maybe there isn't an inherent food allergy. Definitely food makes a massive contribution to the health of the skin. Of course, you do get prescription diets that kind of help to keep the skin barrier in a good condition, so that the external kind of factors don't make it any worse. Things like Heal's Derm Defense or Derm Complete work fantastic. But again, the actual food allergy, as in the animal, the cat or the dog, is allergic to directly to the food that they are consuming, 5%. 5% of animals, if even that. These are pretty tough to resolve initially. It's a whole conversation to have with the owner to tell them the animal needs to go into a food trial. Food trial meaning that we kind of remove any and all food components from an animal's diet, and the animal would only eat the prescribed food. And you do this for at least 2 to 3 months. By then you can see if it was a true food allergy or not. If it was, the animal should be 100%, the skin issue should be resolved. Tough, because the animal needs to go onto this kind of hypoallergenic diet for the rest of their life, or an allergenic diet, which is tough for an owner to keep to. At least this doesn't happen a lot, like I said. So now we're left with basically environmental and contact allergies. Contact allergies can be nice and easy to resolve, because it's pretty easy to make sense of what the animal could have come into contact with. Most common in my experience are plants, or even like detergents and things like that. Dirty water, sometimes maybe. That's more an inflammatory reaction than an allergic reaction. So this is another conversation I kind of have with people. What is the potential that the animal could get into contact with? Trigger factors. Do they maybe apply something to the ear that the animal's ear could be, kind of flaring up to? But the way more... the most common issue for itchy ears is actually a systemic issue, and that is environmental allergies, whether they're seasonal or not. This is a very, very tough conversation to have with owners, because you're sitting with multimodal issues. You're sitting with a systemic kind of issue which affects the animal's overall behavior and overall skin condition, and one of the main manifestations is then that the animals tend to have very erythematous or very red ears, and then that predisposes them to picking up infections like the bacteria and the yeasts. So you're sitting with one issue that kind of progresses to a lot of other issues. And this is where veterinarians tend to place their focus. You exclude all the other factors and then you sit with an allergic reaction. You can do DNA testing to try and identify allergens. You could even sometimes from a cytology exam from an ear, a certain pathologist can make a diagnosis. But the specific allergen is really tough to identify in environmental allergies. And sometimes it's not even worth pursuing that whole road to, it's not worthwhile to go down that road. As I explained to people, what if the test results come back and the animal is allergic to pollens? What are you going to do? Put the animal in a bubble boy? It's not really a practical solution. Sometimes, like, if animals have contact allergies or environmental allergies to plants like grass, I always tell people, oh, that's a simple solution. Just rip out your entire yard, throw down pavement, and your animal's allergy goes away. Really hard and practical resolution, that, isn't it? So what vets tend to do is we identify the environmental allergy and we place the animals on a allergic medication. To my knowledge, there are only 2 registered medications specifically for skin issues, and that's both Apoquel and Cytopoint. We used to use cyclosporin, which was also an immune modulator to help out with skin issues. There are still vets that use it, and it can work very effectively. And then obviously the go-to one is cortisone. And cortisone or prednisolone can actually be used in conjunction with any of these, especially in animals that have really severe cases. Obviously, it comes with a caveat that cortisone is not the best drug to use long-term and does have detrimental health issues, whereas your other drugs also can have long-term health issues, but are more safe and more predictable than cortisone. Again, like I said, you can use the 2 together. So the idea with an entire scratchy or itchy ear consult is to identify and eliminate as much information as you can, literally just from a consultation and discussing it with the owner, especially a presentation of the animal. If they don't have any history of itchy skin, your list becomes really short. If it's a 12-year-old animal with the first time ear infection, unlikely that there's an underlying skin issue. If it's a puppy starting to scratch at 3 or 4 months of age, more likely to be an autoimmune issue or more likely to be an allergy issue. So vets exclude a lot of possible differential diagnoses just based on a conversation. Then identifying parasites excludes another one. Doing a basic ear smear includes or excludes a lot of other things. Scoping the ear, checking if the tympanic membrane is intact, the eardrum, excludes another lot of things. So eventually you narrow down your spectrum of issues to one thing. And the bad news for clients is that generally, animals that have underlying issues, you tend to have lifelong issues. And I prepare clients for this and say, this will not be the first time we will be addressing this ear issue. This will not be the first time your animal will have a flare-up. It is not going to be a once-off ear flush while the animal is here in the vet practice cleaning, placing a solution, and off you go. You will need to continually clean your animal's ear. Some animals become really easy patients at home and they kind of get used to the idea, especially I've noticed in Labrador retrievers and golden retrievers. They get really used to you cleaning out the ear and actually sometimes like it. Other animals really kick their feet into the sand when you try and clean the ears, and they actually get an aversion towards owners and they run away. This is where long-acting ear solutions become really handy, and there are actually a few of them, but generally vets send owners home with a basic ear or registered good, accurate ear cleaner, may need medicated ear treatment, and sometimes, very seldom, they would add systemic treatment as well, antibiotics and antifungals. But the emphasis would be on appropriate ear hygiene and getting any underlying skin issues under control. That is where the focus lies. So I know this was a lot to take in. I hope I did answer all the questions. I hope I didn't miss anything obvious. This is by no means a video for you to take and attack your vet on and say how they miss things or how they should approach things. Not at all. This is purely how I approach things. And this is how I make sure that I don't miss anything. Anything that I do miss or that falls outside my spectrum would obviously then be a referral to a specialist, which does sometimes happen. This is a basic guide, an in-depth analysis for those people that are really wanting all the information and making sure that they have covered all the aspects of an ear issue. especially for cats and for dogs. And for those people wanting all the information, maybe their vet didn't spend enough time explaining everything to them. And I'm hoping this covers all of that. It is a very thorough, informative video. And if you want to watch a kind of more summarized, quicker, easier video, I'll link it down below. I did do a shorter video, but this is how I like to approach it. A short, condensed video with as much information as possible and easy to understand, and then an in-depth analysis of a specific issue. I hope you enjoyed this. If you did, I would really appreciate if you leave me a like, and if you subscribe if you enjoy this type of content. There's a lot more to come. Maybe leave a comment down below if you do have a question that you want answered. Hopefully I can help. And yeah, that's it for now. Until next time, cheers.